Madam Chairman, thank you very much. Mr. Secretary, in 2008, Congress passed the Rural Veterans Access to Care Act. This was a piece of legislation I was involved with in my days in the House. It was signed into law. The program is now referred to as Project ARCH, Access Received Closer to Home. And that legislation set certain criteria that if a veteran lived a certain number of miles from an outpatient clinic or from a VA hospital, the VA would provide those services locally using a local physician, local hospital. My legislation was broad in its initial form. It was narrowed by Congress to create pilot programs. And the vision that Kansas is in was included as one of those pilots. I've expressed my complaint to the VA before because when the VA then implemented its pilot program, it didn't choose a VISN as a pilot project. It chose a community. In my view, we've taken legislation that created a pilot program and created a pilot program within a pilot program, and we now have a project ongoing in Pratt, Kansas to demonstrate whether or not this idea works. I would love to hear the report of progress being made, but also use this moment as an opportunity to again encourage the department to expand this pilot so that you can take more than one community. What happens in Pratt, Kansas, which is less than an hour from Wichita, is significantly different than what happens in Atwood, Kansas, which is 5 hours from Wichita. And the access to providers is totally different between those kind of communities. And so while I'm certainly pleased a pilot program is ongoing, I'm not certain, in fact, I'm completely uncertain, let me say that differently, I'm completely certain the VA has not chosen wisely as it has narrowed the project to a very small scope to determine how it works. And in that regard, along the same topic of the CBOX, we have an ongoing problem similar to what has been expressed in regard to mental health by Senator Tester, and I understand the doctor's testimony about the inability to attract and retain professionals, but it's sure becoming clear to me that we have that same problem outside mental health. Our ability to retain physicians in CBOX across rural Kansas, and I assume across the country, is a huge problem, and more we have nurse practitioners, physician assistants. The availability of a physician has become very limited, and we have many CBOX now that no physician is generally present. And I understand the Secretary's testimony about IT as a potential solution. We certainly have offered to our VISN to make certain that we do everything as a member of the Senate now to provide the VA with the resources to provide the necessary personnel. And it will, my assumption is my answer will be very similar to what you told Senator Tester, and it's the same one that I hear from VISN folks in Kansas is, it's not really a resource issue. We can pay sufficient amounts of money to attract medical professionals, but we're struggling like everyone else to attract those professionals. And I've heard that answer for a long time. You said it again today, Dr. Petzel. In some fashion, that can't be the final answer. Just because everybody else is struggling to attract professionals to take care of patients, we cannot afford to allow the VA to have the same. I understand the problem. I don't mean to be critical in that sense, but there has to be something more than, well, everybody's experiencing this problem. There has to be a path to a solution.
I'm going to ask Dr. Petzel to address your question. I would say, Senator, the rural areas are particularly challenged because of the availability. I think Dr. Petzel said that. And our tools are really reaching out to, and we want highly qualified, we want talent. And our tools are what we are able to compensate, what we're able to award, recognize, and performance of good people doing outstanding work, and retaining through bonuses the high quality ones. So our tools are limited, and but we owe you the best efforts we can to go after that talent, and the biggest challenges are in are in the rural communities, and we have to circle our wagons here.
Mr. Secretary, I appreciate your sentence that you owe us that. We understand we owe our veterans that.
Yep.
But I would also tell you that Congress, I owe you every tool possible to help you meet that criteria. And the complaint or concern I have is that I'm not being asked to do something to solve the problem. And so what I'm asking for is tell us what we can do to provide the assistance so that when we have a hearing 6 months from now, or we're back here next year talking about the budget, the answer to whether or not there's a doctor at a CBOC is not that, or that we're meeting the mental health needs of veterans, particularly in rural areas, is not every healthcare provider, every community, every rural state is having the same struggle we are. Help us help you solve this problem.
Okay, fair enough.
Thank you.
Dr. Petzl.
Senator Begich.
Thank you
sorry.
very-
Do you want to respond really quickly?
I'll try to be very quick. Thank you, Senator Moran. The MD issue first. You're absolutely right that we all have this difficulty in certain rural parts of the country. I would say that if you look at our MD situation across the whole system, we don't have a recruitment problem. It's very important that we focus on the fact that this is rural America. Two things that we would like to do. One is that we need to expand our tuition reimbursement program to be able to provide an incentive for people to go to rural areas by reimbursing them for their tuition from medical school. The second one was an idea that the Secretary had, and I don't want to get into the details of it, but to do something like the military does with their uniformed services medical school, and that is recruit people, pay for their medical education with an obligation to follow, to work with us in particular parts of the country. And those are two areas that we are trying to explore.
I think, Senator, I just put a little finer point on what Dr. Petzl said. I thought that if we went into areas, rural areas, and found a highly talented youngster, great potential, and targeted that individual and got them through the college and the medical process, that they'd be going home. And so in the long run, we would not be facing the retention bonuses and this kind of thing. You'd have provided someone for the long term as a solution to that requirement of that community. That's part of the discussion here.
I appreciate your thoughts, and please consider me an ally. We can follow up with the ARCH
Okay.
question at a later time.
Thank you.
Thank you.
Thank you. Senator Begich.
Thank you very much, and